beach for spring break. Your friend Gloria asked you to send $200 to her for the hotel room. You send the money and Gloria says, thanks. What is the SD for sending money? Okay, behavior question. Whenever we're dealing with MO questions, SD, prompt, consequence questions, first things first, we identify the behavior of interest. Sometimes the questions might have multiple behaviors, multiple people. Identify what behavior you're looking at first, and then analyze. In this case, we're looking at sending money. And in relation to sending money, we're looking for the SD. So some sort of antecedent, some sort of signal to send the money. If we go back, we start with friends planning a trip to spring break. Your friend Gloria asked you to send $200 to her for the hotel room. You then send the money. Pretty clear what the SD is. It's Gloria asking you to send $200 to her for the hotel room. It's a great thing about attacking the question on the exam. Okay, we want to be attacking, right? We don't want to be reading the question, going to the answer choices, jumping back and forth. As you're reading the question, start to predict, start to analyze and answer the question before you even get to the answer choices. So we already know what we're looking for. We're predicting our SD is Gloria asking you to send the $200 to her for the hotel room. So let's see. A, you're planning a trip to the beach. While that is an antecedent, okay, it is not going to be the SD. You sending the money doesn't necessarily have to do with planning the trip. Only when Gloria asks you to send the $200, okay, do you do it, right? So Gloria asking you is the SD. If we look at B, that's what we predicted. Gloria asking for the 200, okay? Gloria saying thanks is the reinforcement for sending the money. So when Gloria asks you to send 200, it signals reinforcement is available for sending the money. That's how an SD works. It signals a consequence is available. B or C, you sending 200 is simply the response. And then D, Gloria saying thanks, again, is just a consequence for you sending the money. So again, what is the SD for sending money is going to be Gloria asking for the $200. Pretty straightforward SD behavior question, okay? If you don't understand that, go back, review the basics. SDs, MOs, responses, and consequences. Greg's boss needs to relay a message to Greg. He attempts to call Greg, but Greg doesn't pick up. Greg's boss then texts Greg the message. Greg's boss is demonstrating what? Okay. What is Greg's boss doing? We're looking at his behavior. Greg's boss wants to relay this message. Okay. That's our stimuli. First, he engages in a response to call Greg. Greg doesn't pick up. He then engages in a response to text Greg. He's texting the same message. We've got the same stimulus, but multiple responses. What do we know about multiple responses for one stimulus? Is that response generalization, stimulus generalization, maintenance, or respondent behavior? Well, it's definitely not respondent behavior. It's okay if you don't know what this is, right? ABA, we deal with operant behavior. Don't worry about respondent behavior. Maintenance, this is not something Greg previously learned. We're not looking to see if Greg can still send a text message. We're only worried about this isolated situation. Leaves us with response generalization and stimulus generalization. What's our rule for response generalization? We have multiple responses for one stimulus. Stimulus generalization, we have multiple stimuli for one response. Of course, here we have our message and then multiple responses. We have a call and then we have a text. Greg is generalizing these responses, okay, across this one stimulus. Greg's boss is demonstrating response generalization. Operant behavior is summarized by a three-term contingency. What is that contingency? Okay, a couple technical terms here. Operant behavior is just what we deal with, okay? When we talk about antecedents and consequences and reinforcement changing behavior, we're talking about operant conditioning. Our three-term contingency, okay, is what you see every day. So don't overthink this and don't get intimidated by the vocabulary. Hopefully you're fluent and you see these words and immediately start to think, okay, I know three-term contingencies. Now, what is our most common three-term contingency we speak about in ABA? Well, that's going to be the ABC, the antecedent, the behavior, the consequence. But is there another one? Is there a more technical definition? Well, if we look at A, this SRS stands for stimulus, response, stimulus. That is the same thing as ABC. Stimulus is the antecedent. The response is the behavior. The stimulus here is going to be your consequence. SR is what we talked about earlier, the respondent conditioning, which you don't need to worry about, just stimulus response. When we talk about a three-term contingency, we're talking about SRS or ABC. So our answer is going to be both A and C. Now, don't panic if this looks like foreign language to you, right? This is a more technical question, okay? But we're trying to push your knowledge even deeper, because if they talk about operant behavior, you should at least know, okay, that's just what we're dealing with every day. We're just dealing with ABC. If they talk about a three-term contingency, same thing. I'm trying to expand your vocabulary, so in case they do use these definitions or terms, okay, you're familiar with them and it's not the first time you're seeing them. So again, when we think about a three-term contingency, just think ABC or SRS. So what is that contingency? It's going to be both A and C. Ben is going to play golf with his friends. He tells his wife the round will take 4 hours and he will be home after. When he gets home, his wife asks him why he was gone 7 hours. What type of measurement did Ben's wife use? Okay, Ben might be in some trouble. He initially told his wife he would only be gone for 4 hours, but he was actually gone 7 hours. When we're dealing with basic measurement, what do we ask first? Are we dealing with time, or are we dealing with the number of responses? This is clearly a time question. We're dealing with hours. What can we eliminate? We can eliminate frequency. Frequency has to do with the count or number of responses. Leaves us with latency, duration, and IRT. Now, are we looking at a total time, right? Beginning to end? Yes, okay. Are we looking at the time in between an SD and a response? No, we're just looking at this total time of his round, so we can eliminate latency. What about inter-response time? Are we looking at the time in between two responses? Again, no, we're just looking at this round of golf. How long did it take? And when you ask that question, how long, straightforward beginning to end, okay, not dealing with SD to response, response to response, just a singular response or a singular situation beginning to end, we are going to be using duration. Pretty straightforward measurement question, okay? We're just taking duration on how long the round lasted. Ben said duration is going to be 4 hours. Wife said, well, it was actually 7 hours. Ben's wife used duration. You're an RBT. Your client's mom, Gwyneth, tells you about this new cream that claims it will improve motor function in children with autism and other disabilities. She asked for your opinion on the cream. How should you respond? Not an uncommon situation. In the field of autism, there are a lot of emerging treatments, emerging ideas about what can and can't benefit our clients and our kiddos, okay? As an RBT, you might be in a position or in a spot where you get asked by a parent or a stakeholder, what do you think? Now, the task list in the ethical code is pretty straightforward and pretty clear about what RBT should do in the situation. Remember, who's responsible ultimately for the client? The supervising BCBA, okay? So even if your heart's in the right place, even if you're an expert on this cream or this intervention, you don't want to be in a position where something you say causes something else to go wrong, okay? Again, we're trying to adhere to a black and white code from the ethics code, okay, in these situations. So how should you respond if you're asked this question? A, tell her you have not done research, but you will get back to her. Saying you haven't done research is fine, but you shouldn't go home, do a bunch of research, and then come back and tell her what you think, okay? That's not your role as the RBT. B, give her your honest opinion on the cream. Again, you might be an expert on the cream. What is your role? Your role is implementation and assistance, okay? And I know that sounds harsh sometimes as an RBT, right? But it's not that you're not trusted to do this job, okay? It's just the chain of command, and it's what the ethical code says. And especially on the exam, we need to answer questions to the ethical code, okay? So C, begin taking data on the cream and the client's motor functions. Now, you wouldn't do this just off the bat, right? You would wait for a intervention plan or a treatment plan. If Gwyneth chooses to use the cream, this is probably going to be a good idea to at least take data, right? Because we can only give our advice. We can't convince parents to do and not do things, right? If they're going to do something, though, we might as well take data on it. However, you shouldn't just immediately start taking data. you should first suggest that she speaks to the supervising BCBA. Okay. Now, if the BCBA comes over during supervision and you're all having a conversation and the BCBA brings you into that conversation, well, that's a different story. Now you're giving your opinion, it's fine. But in the moment, first things first, refer to the supervising BCBA, go from there. Remember, effective, quick communication with the supervisor is essential. How should you respond? D, suggest that she speaks to the supervising BCBA. An art teacher tells her students to begin painting the model they see in front of the classroom. She tells them she will return in 20 minutes. What type of measurement will the art teacher most likely use for the paintings? I think this one is pretty obvious, right? What's the giveaway? Well, the giveaway is she's going to return in 20 minutes. If she's not observing, we know it can't be continuous measurement because it's continuous measurement. We need to observe every instance of behavior. For discontinuous measurement, even though we might not capture every instance, we're still going to capture some. We still need to be directly observing. If she's just leaving the room completely and then going to come back, right, and evaluate, what is she doing? Is she taking duration data? Well, no, we're not timing anything here. We're not looking at the duration of her absence, okay? This is why it's important that we recognize what's the question asking. The question is asking about what type of measurement for the paintings. We're not talking about the measurement for the time she's gone, okay? You need to understand that. Don't just look at the numbers and immediately say, well, 20 minutes is duration, let's pick duration. It's not what the question's asking. Permanent product. Yes, right? Not observing the behavior happen, but once she comes back, she's going to observe the product or the outcome of what was done when she was gone. We're concerned with the product in this case. This is going to be permanent product. Discontinuous measurement and whole interval time sampling are the same thing. Whole interval time sampling is a type of discontinuous measurement. To do either of these, we need to directly observe the behavior, which of course is not occurring. So what type of measurement will the art teacher use? It's going to be B, permanent product. As it relates to a line graph, the x-axis is also known as the what? This is just one of those definition questions, okay? When they ask you graphing questions, it's hard if they don't give you a graph to analyze, to ask graphing questions that don't relate to definitions. So you just need to know that part of the study guide where we define these terms. And the x-axis, okay, where time goes, is also known as the abscissa. The ordinate is the y-axis. Just something you need to know, okay? There's no trick to it. That's just one of those things where fluency really comes into play. Baseline, okay, baseline data, okay, goes on the line graph, but it's not necessarily X or Y axis because it's going to be on both. It's going to be on the graph. Same with the phase change line. It's going to indicate when our intervention changes or when we go from baseline to intervention. They just want to know what the x-axis is also called. It's also called the abscissa. And again, the y-axis is also known as the ordinate. Tony, supervising BCBA, asks for help with an assessment. She tells Tony to intentionally give the client attention. The client starts engaging in attention-seeking behavior. The type of assessment that they're most likely conducting is a what? Interesting. In what situations would we intentionally reinforce attention-seeking behavior by giving attention? That might seem very strange to you if you've just started studying or if you're not familiar with this type of procedure, okay? Ask yourself, are we directly observing the client? Yes, we are, right? Where Tony and the BCBA are engaged with the client. We can eliminate indirect assessment. It leaves us with direct assessment, functional analysis, and narrative recording. Now, narrative recording is a type of direct assessment where we're just writing down what we see, okay? Not necessarily manipulating anything. Are we manipulating stuff here, though? Absolutely. We're manipulating the consequence. If the client engages in attention-seeking behavior, we're going to manipulate that consequence and give attention. We're not just taking a narrative, we're actually engaging. So we can eliminate narrative recording. Now, it gets kind of tricky because you're going to say, well, this is a direct assessment, and you'd be right. But what's a better answer? What's a functional analysis? A functional analysis is the best way to determine a function, okay? We go beyond just observing. Now we're actually manipulating antecedents and consequences. So if we're actually manipulating antecedents and consequences, This is a functional analysis. So direct assessment is good. Functional analysis is better. Now, do RBTs conduct functional analysis alone? No. Do they conduct them without permission? No. Okay. But we do need to be aware of what they are. And if on the exam, it's going to be pretty clear, okay, if we're doing some sort of functional analysis or it's just some sort of basic direct assessment. Okay. Again, yes, this is a direct assessment, but functional analysis is more specific. It's the better answer. On the exam, we need the best answer. That's why we don't just read until we find the answer we like and move on. We read all of the answer choices and evaluate all of them. So the type of assessment they're most likely conducting is a C, functional analysis. You should read and understand the behavior plan before your session begins. If you do not understand one or more aspects of the behavior plan, what should you do? Happens all the time. Nothing at all to be ashamed of. It's nothing to be embarrassed about. You need to be asking questions. Good RBTs are constantly asking questions, constantly asking why, constantly wondering, what are we doing this for? What's the purpose? Okay. Questions. In this case, you don't understand the behavior plan. What are you going to do? You're about to start the session. What's your next step? A, only implement the components you understand and speak with your BCBA during the next supervision meeting. Okay, the first part is perfect. You're not going to implement something you don't understand. However, do we wait until our next supervision meeting? What if next supervision meeting is 2 weeks away? Or are we just going to go 2 full weeks with only implementing some of the behavior plan? Hopefully not. What does the task list say? Quick, effective communication with the BCBA. So A is okay so far. Can we find something better? B, attempt to implement the whole plan to the best of your ability. If you don't understand something, don't implement. Don't try to figure it out. With behavior change, it's very sensitive. You can change something permanently, okay, or semi-permanently when you don't mean to. If you don't understand it, don't implement it. C, do not go to session unless you understand the entire behavior plan. Well, that also isn't the right call. There will be something you can work on, hopefully, okay? So you still need to attend session, but just do what you understand. This is with D. Is D going to be better than A? Let's see. Contact your BCBA as soon as possible and implement only what you understand. That's better, right? The implementation part is identical. Only implement what you understand. But why is D better? Because D, we're contacting them immediately instead of waiting and seeing, okay? There's no time to wait, right? We need to be on it. So if you don't understand something, reach out ASAP, okay? We all have texting, we all have phone, we all have calling, we have everything, right? We're able to reach people instantly, okay? So if you don't understand something, reach out immediately. Until then, you only implement what you understand. One major benefit of discrete trial teaching is what? All right, DTT, discrete trial teaching, discrete trial training, many names, right? But it's all the same. What is discrete trial teaching? Well, we are given an SD, waiting for a response, giving a consequence, post-consequence pause, reintroduce the SD, okay? It's contrived. It's typically done at a table. It's typically used to teach a new skill. What is one major benefit of using this type of teaching? A, the trials are done naturally. Are these trials done naturally? Not typically, right? Typically, it's very contrived. It's very controlled. Because when you're teaching something, you want a very controlled environment. You want to be controlling the prompts. You want to be controlling the consequences. You want to be controlling the antecedents. We're just trying to teach something here, okay? So the trials aren't done naturally. It's typically very contrived. And then B, incidental teaching is a major component of DTT. Is incidental teaching the same thing as natural teaching? Yes, okay? Natural teaching is not a major component of DTT. These two are like the umbrellas, okay? Natural teaching and DTT both serve their purposes, but incidental teaching is not a major component of DTT. C, many trials can be run in a short amount of time. Yes, the speed is so great in DTT because we can do a lot of trials quickly. If we're doing matching to sample, for instance, and you want to match a picture of an apple to another picture of an apple, you can do 5-10 matching trials in a couple minutes, right? It's great. We can deliver a lot of reinforcement, a lot of feedback very quickly. Speed is definitely a major benefit of DTT. And then D, the DTT is great for generalization. Generalization is typically done with natural teaching outside of this DTT environment because DTT is typically very controlled. For generalization, we need more of a loose environment, okay? We can't control everything when generalizing. So one major benefit of discrete trial teaching is what? C, many trials can be run in a short amount of time. All right, thanks for watching. I hope you enjoyed. Please like and subscribe. I really appreciate it. If you're looking for a study materials, check out rbtexamreview.com. We offer 3 full practice exams, a task list study guide. Our combo pack comes with everything, plus flashcards, and of course, our competency study guide as well. Wednesday, we'll be back with more practice questions, and then Friday, Saturday will be our BCBA questions as well. Anything else, let me know. I'd love to help. Work hard, study hard. See you soon.